Sir, can you explain the mechanism of action, clinical uses, and adverse effects of metronidazole? So I am getting confused regarding mechanism as well as uses and difficult to remember with which drug has to be used for anaerobic infection below the diaphragm as well as above the diaphragm. So can you help me in this regard, sir? Yes, definitely I can explain you regarding the metronidazole. So metronidazole, you need to remember under these three headings. One is the mechanism, clinical uses, and the adverse effect profile. So mechanism of action of metronidazole is it forms a free radical. It forms a toxic free radical which will going to damage the bacterial DNA. That's why they're called as bactericidal agents. In addition to that, it also has got anti-protozoal property. So this is the mechanism of action. So how to remember the clinical uses? So you need to remember the mnemonic called as GET-GAP. So GET-GAP stands for GET-GAP. So G stands for Giardia, E stands for entamoeba, T stands for trichomoniasis, and one more G stands for Gardnerella vaginalis. A stands for anaerobic infections like uh, bacteroides and Clostridium difficile, and P stands for H. pylori infections. So metronidazole can be used in place of the amoxicillin whenever the patient is having allergic to penicillin. So one more thing you should remember is metronidazole is used for anaerobic infection below the diaphragm, whereas for anaerobic infection above the diaphragm, you will going to use clindamycin. So what is the adverse effect of metronidazole you need to remember? You need to remember that whenever it is consumed along with the alcohol, it causes disulfiram-like reactions leading to the symptoms like hypotension, tachycardia as well as the severe flushing. And also this metronidazole has got metallic taste and also it produces headache. So this is how you're going to remember the mechanism of action, uses as well as the adverse effects of metronidazole. Just to have a summary, metronidazole forms a toxic metabolite which damages the DNA, thereby it produces bactericidal effect, plus it has got anti-protozoal effect. The uses, they are used in GET-GAP, that is Giardia, entom, uh, entamoeba, trichomoniasis, Gardnerella, anaerobic infection below the diaphragm, and for H. pylori. Side effect, it causes metallic taste and disulfiram like reaction if consumed along with alcohol. That's it.